Hello all, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary medicine. Question number first, which of the following is used as a hyperosmotic cathartics to cleanse the bowel? Options A, bisacodile, options B, psyllium husk, option C, docusate sodium, or options D, lactulose. The right answer is options D, that is a lactulose. That example of hyperosmotic cathartics, that is a lactulose. Since cathartics, laxatives, purgatives are the substance that promote or accelerate defecations or evacuates of fecal material from the bowel, either by increasing the that motility of intestine or by increasing the fluidity of feces. Okay, if you see that laxatives are the terms which is used for mild cathartics or purgatives. Okay, on the basis of mode of actions or mechanisms, these cathartics, laxatives, purgatives are of following types. First is bulk forming. Bulk forming include those cathartics which are made up of fibrous materials such as cellulose and non-digestive polysaccharides. They undergo partial that digestions, and they are hydroscopic in nature. They absorb water from that lumen and form soft bulky feces. And then example of a bulk forming cathartics that include methyl cellulose, isabgol, psyllium husk, psyllium seeds, agar, sodium methyl cellulose extra. Okay, and second is saline or osmotic cathartics. These are actually hypertonic solutions which increase osmotic pressures in GI tract and increases absorptions of water from cells into GI tract and promote evacuation of feces. If we see that example of saline and osmotic cathartics that include docusate sodium, sodium phosphate, lactulose, sodium biphosphate, potassium sodium tartarate, magnesium hydroxide, magnesium citrate, magnesium sulfate, potassium phosphate, potassium bitartrate extra. Okay, and third is stimulant or irritant. These are those cathartics which act by causing local irritations on that intestinal tract and leads to increase the peristalsis movement and promote evacuations of feces. If we see that example of stimulants or irritant cathartics that include cascara, rhubarb, castor oil, and bisacodile. Okay, last is that emollient or lubricant or stool softener. These are the stool softener which promote penetrations of that water which liquefy the stool and promotes its easy evacuations. If you see that example of emollient or lubricant or stool softener, then it's minerals oil, castor oil, liquid paraffin, glycerin, docusate sodium extra. Questions number second. Metabolic acidosis can occur in options A, severe diarrhea, options B, intestinal obstructions, option C, impactive colic, or options D, all. The right answer is options D, that is all. Metabolic acidosis can occur in all conditions, that is when there is a severe diarrhea, impactive colic, or intestinal obstructions. Uh, Actually, that metabolic acidosis is the conditions where there is a pH of a blood is go below that 7.35, mainly seen when there is decrease biocarburate concentrations in blood. Since and that metabolic, we can consider metabolic that alkalosis when the pH of that blood goes beyond 7.45. Okay. Questions number third. Gag reflex test is performed to know the functional ability of options A, glossopharyngeal nerves, options B, vestibulocochlear nerves, option C, hypoglossal nerves, or options D, trigeminal nerves. The right answer is options A, which is a glossopharyngeal nerves. Okay, the gag reflex test is done to evaluate the integrity or that function of a cranial nerves 9 and cranial nerves 10. Cranial nerve 9, that is glossopharyngeal nerves, and 10 is vagus nerves. In this test, by using the long handle swab stick, we gently touches the pharyngeal wall behind the pillar of a fauces. Fauces is that an arm which is the opening, which is the opening of that pharynx and that ending of that mouth part. In a positive case, there will be produced non-symmetrical elevations of the fauces, and if there is a no movement of a fauces signifying bilateral palatal muscles paralysis. In a normal gag reflex, there is a symmetrical elevations of the fauces. Okay. Questions number 4. Water hammer pulse is pathognomic of options A, interventricular septal defect, options B, patent ductus arteriosus, Option C, dilated cardiomyopathy, or options D, aortic incompetence. The right answer is option A, which is a interventricular septal defect. Water hammer pulse is a pathognomic of interventricular septal defect. Actually, water hammer pulse, also known as Corrigan pulse or also known as hyperkinetic pulse, is a pulse which is mainly characterized by there is a abrupt, very rapid upstroke of the peripheral pulse followed by rapid collapse. Results from when there is a very rapid ejection of that large left ventricular stroke volume and into the low resistance arterial systems. Okay, this condition is mainly associated with chronic aortic regurgitations, but also seen in other conditions associated with increased stroke volumes, like patent ductus arteriosus, when there is a it is a fetal developmental defect where there is a communications between that right atriums and pulmonary arteries, and there is aorta is found. Interventricular septal defect, when there's a two ventricles are that communicated each other. Anemia and extreme bradycardia. Okay. Questions number 5. Which of the following is termed as diastolic sound? Options A, first heart sound. Options B, second heart sound. Option C, third heart sounds. Or options D, fourth heart sounds. The right answer is option C, that's the third heart sound. Third heart sound is termed as diastolic sound, and actually that heart sounds are the sounds which is produced by a heart during cardiac cycles, especially at the time when the valves is closed. Okay, there are four types of heart sounds we can hear, that's S1, S2, S3 and S4. If we see that the cause of S1 is when there is a closure of atrioventricular valve, that's a valve which is present between atrium and ventricles, that's tricuspid valves which is present between right atriums and right ventricles, and bicuspid valve which is present between left atrium and left ventricle. When this valve closes, they produce a sound which is the S1 sound. Okay, and if we see that nature of S1 sound, it is a high pitched sound, and we heard that lub sound represent that S1 sound, and duration of this S1 sound is 0.14 sec, and the timing when the it starts when the ventricular systoles starts. Okay, systole is means like contractions. When a ventricular contractions starts, this sounds we can hear. Okay, second sound is S2 sounds, which is the S2 sounds is produced due to the closure of semilunar bulb, which is that aortic valves and pulmonic valves. Pulmonic valves is present between that right ventriculars and that pulmonary arteries, while aortic valves is present between left ventriculars and that aortic arteries. And this sound represents dub sound, and it is also that as compared to that lub sound, it is more higher pitched, and the duration of this sound is 0.11 sec, and it represents that the end of the ventricular systoles and beginning of the ventricular diastoles. Okay, that is ventricular contractions, and there's end and there's a start of that ventricular relaxation. Okay, S3 is normally that rapid ventricular filling, when the blood comes from that the arterium to the ventricular. At that time, a certain sound is produced, which is the S3 sound. And if you see that nature of this sound, this is soft and slow pitched and weak rumbling sound, and the duration of this sound is 0.1 sec, and it is begin at the middle third of diastoles. So S3 sound is considered as a diastolic sound, which is produced when the ventriculars in relaxation positions. Okay, and S4 sound is that end of that ventricular filling, when there's a ventricle is fully filled, sound is produced, that is known as S4 sound. And the nature of this S4 sound is also weak and rumbling, and it is the last rapid filling phase. Okay, it represents that the last rapid filling phase. Okay, we can't heard S4 sound normally. S4 sound we only heard by mean of a phonoendograph gram. Okay, questions number 6. Hypotonic dehydrations means options A, loss of fluid without sodium. Options B, loss fluids only. Option C, loss of sodium without much fluids. Or options D, loss of fluids with sodium. The right answer is options hypotonic, that is a loss of fluids with sodium, D. Let's see different types of dehydrations. Then we found there's a isonatremic or isotonic dehydrations, and hypertonic dehydrations and hypotonic dehydrations. Okay, when the losses of water and sodium is equal, that is known as isotonic or isonatremic dehydrations. When the water loss is more as compared to that sodium, that is known as a hypernatremic or hypertonic dehydrations. When the sodium loss is more as compared to the water, that is known as hyponatremic or hypotonic dehydrations. And during that isotonic dehydrations, the plasma osmolality doesn't change, that is normal. In case of that hypertonic dehydrations, plasma osmolality increases. In case of hypotonic dehydrations, plasma osmolality decreases. Okay, and if we see that serum sodium level, which is normal in case of isotonic, increases in case of hypertonic and decreases in case of hypotonic. Okay, questions number 7. Adipose shear means options A, accumulation of fat, options B, post-mortem changes, option C, tumor of adipose tissue, or options D, ante-mortem changes. The right answer is options B, which is a post-mortem changes. Adipose shear is actually a post-mortem changes, that is a putrefaction, a types of putrefaction. Adipose shear is a process of formation of offensive, rancid smelling, soft whitish, crumbly, waxy, greasy material which is similar to soap, occurring in a fatty tissue of a dead body subjected to moistures. Okay, when a dead body is that subjected to the moistures, at the time that the fat changes into the fatty acids and lead to form that adipose hairs. Okay, questions number that 8. Which of the following is having good therapeutics value in frothy bloods? Option C, antizymotics. Options B, non-ionic surfactants. Option C, minerals oil. Or options D, all. The right answer is options D, that is all. Okay, let's see the difference between frothy bloods and free gas bloods. Okay, frothy bloods is also termed as primary tympani, while free gas bloods termed as secondary tympani. Frothy bloods is occurs when there is after ingestion of green legumes, while free gas bloods is occurs when there is a physical obstructions in the process of eructations of gases. Frothy bloods is like foamy in nation. That's a foam gas with bubbles is seen in case of frothy bloods, while the free gas bloods is gaseous in nature. Okay. Antizymotic drugs are the drugs which prevents or decrease excess microbial fermentations in rumen and intestine. It is used in blood, tympanic colic in horse and cattle. And if we see the example of antizymotic drugs, that is include turpentine oil, linseed's oil, formalin extra. Second is non-ionic surfactants. Example of non-ionic surfactant, that is a polazalin, which is act as anti-forming agents. It's prevent the formations of forms and prevent frothy bloods. Example of non-ionic surfactants, that is a polazalin, monensins extra. Mineral salts also act as anti-forming agents. It also prevents frothy bloods. For the treatment of a gas bloods, we need to puncture at the paralumbar fossa with the help of talker and cannula and release this gas. Okay. Questions number 9. Mad cow disease is options A, bovine spongiform encephalopathy, options B, encephalomalacia, option C, sporadic bovine encephalomyelitis, or options D, all. The right answer is option that is A, bovine spongiform encephalopathy. Mad cow disease is also known as bovine spongiform encephalopathy. Is actually a progressive, transmissible neurological disease of a bovine, mainly characterized by that sponge-like destructions of a brain and cytoplasmic vacuolations of that neuron. Is mainly caused by a prion, which produces slow infections with long incubation periods like several months to year. And if you see that sporadic bovine encephalomyelitis is this infectious neurological disease which is mainly caused by chlamydia picorum, and it's mainly affect cattle and buffalo and mainly characterized by fever, depressions, excessive salivations, diarrhea, anorexia, weight loss. And in this case, the lesion is not limited to brain only, but parocerositis take place. There's a inflammations of many serous layers like peritonitis, pleuritis, pericarditis is seen. Okay. Questions number 10. Which of the following is important test to detect subclinical mastitis? Options A, NAG's activity. Options B, somatic cells count. Option C, electrical conductivity. Or options D, all. The right answer is options D, that is all. Naga's activities and somatic cells count and electrical conductivity test are the tests done to confirm subclinical mastitis. Nagas is an intracellular that lysosomal enzymes that is released into milk from neutrophils during that phagocytosis, and cell lysis, but also from damaged epithelial cells, which indicated that udder tissue destructions. Okay. Normally that electrical conductivity of that normal milk is low as compared to that mastitis milk, and it is increases during the mastitis due to increased ionizable salts in milk from inflamed quarter. Okay. Questions number 11. Which of the following is the marker of early stage of hepatic dysfunctions in cattle? Options A. Gamma glutamyl transferase. Options B. Alkaline phosphatase. Option C. Aspartase aminotransferase. Or options D. Sorbitol dehydrogenase. The right answer is option A. That's a gamma glutamyl transferase. Okay. Gamma glutamyl transferase is a marker of that early stage of hepatic dysfunctions in cattle, as gamma glutamyl transferase is an enzyme which is found throughout the body, but mostly found in liver. And when the liver is damaged, at the time this gamma glutamyl transferase leak into that blood streams, and high level of GGT in blood is a sign of liver disease or damage to bile duct. Okay. Next is serum alkaline phosphatase is a liver biomarker. A higher than normal level in blood indicate problem with liver or gallbladder. This could be hepatitis, cirrhosis, liver cancer, gallstone, and blockage in bile duct. Okay. Third is aspartate aminotransferase, that is also known as serum glutamate oxalo transferase, is an enzyme that check for liver damage. Increase AST level in blood indicate liver damage. Okay. Next is sorbitol dehydrogenase. Sorbitol dehydrogenase enzyme deficiency is a progressive, debilitating hereditary neuropathy that affect peripheral nerves and motor neuron, resulting in significant disability, loss of sensory functions, and decreased mobility. Okay, it is not related with that liver. Okay, since gamma glutamyl transferase is a marker of that early stage of hepatic dysfunctions, while serum alkaline phosphatase and asparatate aminotransferase is a marker of that late stage of hepatic dysfunctions. Okay. Questions number 12. Moderate leukocytosis, neutrophilia with a left shift is suggestive of options A. Acute local peritonitis. Options B. Chronic local peritonitis. Option C. Acute diffused peritonitis. Or options D. None. The right answer is options A. That's acute local peritonitis. In acute local peritonitis, there is a moderate leukocytis, that's increase in leukocytes number, with left shift of neutrophilia. That is a neutrophilia. That is a left shift. That's immature neutrophils is large in number. Questions number 13. Complete loss of ability to absorb immunoglobulin in colostrums occurs in options A. 6 to 8 hours after birth. Options B. 8 to 12 hours after birth. Option C. 12 to 20 hours after birth. Or options D. 24 to 36 hours after birth. The right answer is options D. That is 24 to 36 hours after birth. Okay. A complete loss of ability to absorb immunoglobulin in colostrums occurs by 24 to 36 hours after birth. Questions number 14. Important biochemical changes in baby pig disease is options A. Hypothermia, options B. Hypoglycemia, option C. Hypocalcemia, or options D. Anemia. The right answer is options B, which is a hypoglycemia. Important biochemical changes in a baby pig disease is a hypoglycemia. Baby pig disease is a known as neonatal hypoglycemia. It's mainly seen in a pig which pig born first few days of birth. Okay, and is mainly characterized by there's a nervous signs like convulsion, shivering, hypothermia, gait abnormalities, and caused due to deprivations of food. If we see that predisposing factors, we found there's a age dependent characteristics like during first few days of life, the capacity of gluconeogenetics enzymes, that is enzymes which leads to form that glucose from that other than glucoglycogens, that is a phosphoenol pyruvate carboxy kinase, is only 20 to 40%, so that the gluconeogenesis is impaired and lead to deficiency of glucose. Okay, and if you see that next is that characteristic of species. Some characteristics of species have like mainly a pig has low carbohydrate and lipid reserve as compared to other species, and it increases the demand for higher temperature as compared to other, and pig has thin hair coat, and there's severing thermogenesis in we can see in pig too. Okay. Questions number 15. Which of the following is an uncommon sequels of TRP, traumatic reticuloperitonitis? Option C, diaphragmatic hernia. Options B, diffuse peritonitis. Option C, rupture of left gastroepiploic artery. Or option D, congestive heart failure. The right answer is option C, that is a rupture of left gastroepiploic artery. Let's see the sequels of TRP. That's a TRP can lead to certain conditions like diaphragmatic hernia, diffuse peritonitis, congestive heart failures. Okay. Questions number 16. Presence of form immunoglutamic acid in urine is confirmations of options A, copper deficiency, options B, selenium deficiency, option C, cobalt deficiency, or option D, calcium deficiency. The right answer is option C, that's a cobalt deficiency. If we see that presence of form immunoglutamic acids in urine, it's a confirmed there's a deficiency of cobalt, since form immunoglutamic acid is that intermediate metabolite which is produced in a pathway that convert histidine to that glutamic acids, and that for the degradation of this for immunoglutamic acids, there's a needed of a folic acid is needed, and in the deficiency of this folic acid, this form immunoglutamic acids accumulates in excessive amounts and is excreted in urine. Okay. And since the cobalt deficiency lead to deficiency of folic acids, which leads to that aggregations of that form immunoglutamic acids within a blood. Okay. Questions number 17. Oxytetracycline is contraindicated in options A, young animal, options B, pregnant animal, option C, old animal, options D, both A and B. The right answer is options D, that is both A and B. Okay. OTC, that is oxytetracycline, is contraindicated in pregnant animal, lactating animal, and also that young animal. If we see that antibiotics such as aminoglycosides, amphotericin B, chloramphenicals, quinolone, lincomycin, nitrofuran, sulfonamides, these are contraindicated in animal with that renal insufficiency, where there is a kidney, when there's a kidney problem. These antibiotics are not used because these antibiotics mainly used renal route for their excretions. Okay. And antibiotics such as chloramphenicol, clindamycin, griseofulvin, ketoconazole, lincomycin, macrolide, metronidazoles, rifampicin, sulfonamide, tetracyclines. These are contraindicated in animals with that hepatic insufficiency, when the animals suffer from that liver disease, because this antibiotics takes that liver roots or that fecals root for their excretions. Okay. Antibiotics such as aminoglycosides, amphotericin B, azithromycin, chloramphenicals, fluconazole, quinolone, griseofulvins, ketoconazole, sulfonamide, trimethoprim, metronidazole, nitrofurans are contraindicated in pregnant animal because they can cross that blood-brain, any blood placental barriers, okay, and can hamper to that the new one. Okay. Antibiotics such as aminoglycosides, chloramphenicol, quinolone, metronidazoles, nalidixic acids, rifampicin, sulfonamide, tetracyclines are contraindicated in neonate animals. Okay. Questions number that 18. Pseudo cowpox lesions are characterized by options A, pus, options B, horseshoe shaped ring scab, option C, that is a blood oozing, options D, none. The right answer is options B, that is a horseshoe shaped ring scabs. Pseudo cowpox, which is also known as milker nodules or ring sore, is an infectious disease of that cow and buffalo, is mainly caused by that parapox virus and characterized by there's a cutaneous eruptions of on the tit, udder and perineums, leaving a small horseshoe shaped lesions that is known as ring sore. Questions number 19. Swine pox is options A, malignant disease, options B, benign disease, option C, that is mixed disease, or options D, none. The right answer is options B, that is benign disease. Swine pox, that is known as variola suila or contagious impetigo, is a highly contagious viral disease, highly contagious viral disease of swine caused by Swine-pox virus, is mainly characterized by there's a pox lesions in different parts of the body, like snouts, eyelids, inner aspects of the thigh, skin of axilla, or external surface of ear. Okay. Questions number 20. The viral disease of horse restricted to North and South America only. That is option A, equine infectious anemia. Options B, equine influenza. Option C, equine encephalomyelitis, or option D, African horse sickness. The right answer is option that is C, equine encephalomyelitis. The viral disease of horse, which is restricted to North and South America only, is equine encephalomyelitis. Equine encephalomyelitis, that is Eastern equine encephalomyelitis, Western equine encephalomyelitis, Venezuelan equine encephalomyelitis. It's mainly caused by that alpha virus, and it is transmitted by bites of infected mosquito, that is culicoids mosquitoes, and characterized by there's in case of fever and severe depressions, sleeping sickness, behavioral change, circling or head pressing, paralysis, convulsion, death, extra. Equine infectious anemia, which is also known as swine fever or EIA, is a chronic persisting infectious viral disease of equine. Is mainly characterized by there's emaciations, anemia, and then intermittent fever. Like sometimes fever get high and sometimes get low, and there's a generalized lymphoproliferative changes. Uh, and edema caused by lentivirus of family Retroviridae. Okay, next is equine influenza. Equine influenza is known as equine distemper, typhoid fever, catarrhal fever, also known as pink eye, is mainly caused by myxovirus A equi 1 and A equi 2, characterized by there's a general septicemia and respiratory problems accompanied by severe persistent dry cough. Okay, influenza, so there's a respiratory problem accompanied by there's a dry cough. Okay. African horse sickness is a hemorrhagic disease of equine, characterized by there is a pyrexia, okay, a respiratory and circulatory impairment, okay, edema of the lungs, pleura, subcut tissue, as well as there is a widespread petechial hemorrhage, okay. Pulmonary form of African horse sickness, where there is a respiratory symptoms are predominant, that is known as a dung cough, while circulatory form is known as decop, mainly caused by this African horse sickness is mainly caused by Orvi virus of family Rheoviridae, okay. Questions number 21. The drug of choice in the treatment of wooden tongue. Options A. Alincomycin. Options B. Gentamicin. Option C. Potassium iodide. Or options D. Oxytetracycline. The right answer is options C. That is potassium iodide. Drug of choice for wooden tongue. That is a actinobacillosis. Is that potassium iodide? Okay. Let's see the different diseases along with their drug of choice. In case of anthrax, swine erysipelas, strangles BQ, which is a gram-positive bacteria, the drug of choice is penicillin. In case of hemorrhagic septicemia, the drug of choice is sulfonamide, which can give an IV. Okay. In case of actinobacillosis or actinomycosis, that is a wooden tongue and that lumpy jaw conditions, the drug of choice is potassium iodide and sodium iodide. In case of campylobacteriosis, that is streptomycin. In case of CBPP and CCPP and CRD, that's which is caused by that mycoplasma species, the drug of choice is tylosins and tiamutin. Okay. Questions number 22. Vaginal mucus agglutination is useful to diagnose options A. Brucellosis, options B. Anthrax, option C. Erysipelas, options D. Leptospirosis. The right answer is options A, which is a brucellosis. Okay, that brucellosis. Okay, let's see some recommended diagnostic test for different diseases. Since in case of milk fever, there's a Sulkovich test where we test that calcium level in urine. Hypomagnesemia, where we xylitol test where we test magnesiums in urine. Simple indigestions, sedimentation activity test. Ketosis, that's Rothera test and Rose test or Cowside test where we test ketone bodies in urine and milk. Okay. In case of LDA, left displacement of omasum, there's a lip tuck test. Okay. In case of TRP, there's a pole or bamboo test. Okay. In case of equine infectious anemia, that's a Coggin test. Okay. Cyanide poisoning, there's a Pickett test. Nitrate poisoning, diphenylamine blue test or starch iodine test. Hematuria, there's a benzidine test where we test that RBC in urine. Glycosuria, Benedict test, which test that glucose level in urine. Proteinuria, Heller test or Biuret test. Bile pigment in urine, that is a Pouchet test or Melin test. Okay. Streptococcus agalacti, that is a hottest test. Bile salt in urine, that is a Hay test. Hydatidosis, Cassoni test. For trichomoniasis, Tricin test or mucus agglutination test. Anaplasmosis and babesiosis, that is a capillary agglutination test. Toxoplasmosis, that is Sabine and Feldman dye test. Trypanosomiasis, that is a Farmal gel test and steel barmidine test or mercury chloride test. Streptococcus pyogen, that's a Dick test or bacitracin test extra. Questions number 23. The following species is resistant to botulisms. Options A, that's a pig. Options B, cattle. Option C, horse. Options D, sheep. The right answer is options A, which is a pig. Okay. Species that resistance to botulisms conditions, that is a pig. Okay. Botulism is known as limber neck or lion disease. Is a toxemic paralytic disease of a man, animals, and bird. Is mainly caused by the ingestion of a toxin of a Clostridium botulinum, which is a gram-positive bacteria. Common this Clostridium botulinum is a common inhabitant of that digestive tracts of animal. These organisms do not produce toxin within an animal body, but toxicity occurs due to the ingestion of that preformed toxins. Drinking water contaminated with dead and decomposed carcass, decomposed hay and silage, imperfectly preserved hay, sauces, or other meat product are the source of these preformed toxins. And the ingested when there is the ingestion of this toxin contaminated food, the ingested toxins are readily absorbed and get disseminated throughout the body and ultimately reach the nerves localized in a peripheral nervous systems, produce motor nerves paralysis. And if we see that's clinical signs which are associated with botulisms, then we found that partial or complete paralysis of muscles of locomotions. There's a stiff gaits. There's a difficulty to raise their body, leg folded underneath the body. Animal fail to hold his head in that normal positions and head rest on a flank region extra. And if there is a presence of suspicious foreign materials in the forestomach of in postmortem of a cattle, that suggests botulism's conditions. Okay. Questions number 25. Trismus with restricted jaw movement, sawhorse postures are characteristic symptoms of options A. Actinobacillosis, options B. Listeriosis, option C. Enterotoxemia, or options D. Tetanus. The right answer is options D, that is tetanus. Okay. Trismus, that is a spasm of that jaw muscles, which is lead to that restricted jaw movement, and sawhorse postures is a characteristic symptoms of tetanus. If you see the typical clinical signs which is associated with tetanus, that is sawhorse postures, lockjaw conditions, prolapse of the third eyelid, and pump handle position of the tail extra. Actually, tetanus is a non-contagious, non-febrile infections, the disease of mammals, is mainly caused by toxin which is produced by Clostridium tetani. Is characterized by spasmodic contraction of the skeletal muscles, and the organism this Clostridium tetani organisms produce three types of toxin. That is a tetanospasmin, which is a neurotoxin actually, tetanolysins, which is a hemolysins, which can damage that blood tissues, and fibrinolysins. Okay. Questions number 25. Ingestion of a contaminated, the transmissions of encephalitis form of listeriosis occurs by options A. Ingestions of contaminated milk. Options B. Infections of tooth cavity. Options C. That's infections through navel. Options D. None. The right answer is options B, which is that infections of tooth cavity. Transmissions of encephalitis form of listeriosis occurs by infections of tooth cavity. Since listeriosis, which is also known as circling disease, meningoencephalitis, silage disease, is an infectious fatal disease of animal and men, mainly characterized by this inflammation of the brain, that is encephalitis, abortions, and endometritis, which is inflammations of that endometrium layer of uterus, and repeat breeding in animal. Listeriosis is mainly caused by Listeria monocytogenes, which is a gram-positive bacteria. Infections mainly occur through that infected feed and soil. And silage is also considered as important spreaders of disease. Carrier animals and rodents may also spread the disease. The bacteria gain entry through that GI mucosa, reach the circulations causing bacteremia, get localized in various organs, produce three types of manifestation. That is disease with encephalitis, where nervous signs is predominant, like head is placed against the barrier, circling movements, paralysis of pharynx, and there's respiratory failures. Second is disease with abortions, where we can see that abortions in seen in pregnant animal, and disease with septicemia, where the signs includes like blood infections, that's depressions, weakness, pyrexia, and diarrhea, and corneal opacity. Okay. Questions number 26. Predilation sites for Brucella abortus is options A. Pregnant uterus, options B. Udder, option C. Testicles, options D. All. The right answer is options D. That is all. Okay. Brucellosis, which is also known as Bank disease or contagious abortions or endotic abortions, undulant fever, Malta fever, is an acute or chronic contagious disease of domestic animal, mainly characterized by there is a inflammation of placenta, that's placentitis, and abortions mainly caused by Brucella abortus in case of cattle, Brucella melitensis in case of goat, Brucella obis in case of sheep, and Brucella canis in case of dog. It's a gram-negative, non-spores forming bacteria. Okay. Since Brucella has got affinity to that invade gravity uterus, mammary gland, testis, and placenta, upon infections, this bacteria gain access into the body through that mucous membrane of that oropharynx or urinary tract, that upper respiratory tract, or that conjunctival mucosa, abraded skin, and cervix of genitalia. Following entry, the organisms localized nearby lymph node get multiplied and then enter circulations, cause bacteremia. Move to that affinited organs like placenta, causing inflammation of the placenta, placentitis, gravidutis, causing abortions at last trimesters, mammary glands, causing mastitis, and testes, causing orchitis. A substance known as erythritol is produced by fetus. That's capable of triggering the multiplication of this Brucella abortus. Okay. Questions number 27. The type of Newcastle disease where this virus is very virulent is option C biologenic, options B mesogenic, option C lentogenic, and options D none. The right answer is option A, which is a velogenic. The type of that Newcastle disease virus, which is more virulent, that is velogenic, which is followed by mesogenic form and then lentogenic. Okay. Questions number 28. Shipping fever in cattle is caused by options A. Pasteurella hemolytica, options B. Pasteurella multocida, option C. Mycoplasma mycoides, or options D. Chlamydia psittaci. The right answer is options A, that is Pasteurella hemolytica. Okay, shipping fever in cattle, that is a that animals that cattles get that infections or that showing the symptoms when they are transferred from one place to another. Okay, that's known as shipping fever, and it's mainly caused by Pasteurella hemolytica. Okay, Pasteurella multocida first cause hemorrhagic septicemia in cattle. Okay, Mycoplasma mycoides cause CBPP, that's contagious bovine pleuropneumonia. Okay, and Chlamydia psittacis cause psittacosis in case of human, and avian chlamydiosis in case of mammal. Okay. Questions number 29. The allergic test conducted on horse for the diagnosis of glandular is called option C Strauss reactions, options B Mellin test, option C Jonin test, option D Coggin test. The right answer is option C, that is B, which is a Mellin test. Okay, the allergic test that conducted on a horse for the diagnosis of glandular, that is Mellin test. Okay, Mellin test, that is intrapalpebral or the dermopalpebral test. It's a routine test for glandular. In this Mellin test, that 0.1 ml of that Mellin is injected intradermally into the lower eyelid with a tuberculin syringe, and the test is read at 36 to 48 hours. In a positive case, we can see there's an extensive edema of the eyelid and congestion of that conjunctiva and mucopurulent secretions, and this swelling persists for 2 to 3 days. Okay, a Strauss reaction is also the test for that the glandular. In this case, that the male guinea pig, when inoculated intraperitoneally or subcuts with suspected materials, local reactions take place. In positive case, which is leading to the positive painful orchitis in case of that guinea pig. Okay, zoning test is done for that paratuberculosis, while Cogging test is a confirmatory test for that equine infectious anemia. Let's see some gold standard test for different diseases. Like in case of leptospira, that's microscopic agglutination test. In case of rinderpest, that is complement fixation test. In case of PPR, that's virus nutrition test. In case of influenza, that is hemagglutination test. In case of rabies, swine fever, that is a fat and amphibian test. In case of FMD blue tongue, that's a competitive ELISA. In case of African horse sickness, that's indirect ELISA. Or in case of IBD, that's quantitative AGID. Okay. Questions number 30. Fowl typhoid in poultry is caused by options A. Pasteurella multocida, options B. Salmonella typhimurium, option C. Salmonella gallinarum, or options D. Chlamydia psittaci. The right answer is option C, which is a Salmonella gallinarum. Okay. Fowl paratyphoid, that is avian salmonellosis, is mainly caused by Salmonella typhimurium, while fowl typhoid is mainly caused by Salmonella gallinarum, and pullurum disease, that is known as bacillary white diarrhea, is mainly caused by Salmonella pullurum. Okay, that must for today. Thank you.